afternoon, everyone. It is 12:51. We apologize for the delay. We've had some technical difficulties, but because we have all of our board members in attendance in person who are going to be here, we are able to start the meeting now, and we are live. So at this time, I will call to order the March 2023 regular meeting of the Spokane Regional Health District Board of Health. Ann, would you take roll for us, please?
Yes. Commissioner Josh Kearns.
Here.
Present.
Commissioner Mary Cooney.
Present.
Board member Christopher Patterson.
Present.
Board member Alicia Policani.
Present.
And board member Charlie Duranona is not expected at the meeting.
Excellent. So for the record, we do have a quorum of members today. And so at this time, I would like to ask, we can just, we don't even have to modify the agenda today then because we have everybody here. So at this time, we will move forward with the board reports. I will begin with the chair report. Today, I would like to just provide an update to the board on the current search for the administrative officer. We, at this time, have advertised the position, and we are obtaining interest from both individuals, and we have some qualified individuals that our recruiter is currently evaluating and working with on developing a candidate pool for us. We anticipate that we will allow that candidate pool to develop until probably toward the end of April. And then at that time, we'll begin the actual sorting process of eligible and appropriate applicants. Right now, we have finished the internal stakeholder meetings. Yesterday, we had a listening session with myself and the recruiter, Tom Young from Raffet Associates, and invited staff to come in and talk to us about what they felt were qualities, skills, anything about what they felt the administrative officer position or officer quality should have. That was very successful. We had a number of applicants, or a number of individuals come forth and talk to us about it. The recruiter has reached out. We assembled a group of external stakeholders, and we have finishing reaching out to the external stakeholders with the same questions in mind. What do you as external stakeholders look for as part of the, or believe should be qualities of the administrative officer? We will be putting together, the recruiter will be putting together a summary of the external stakeholders' comments and the internal stakeholders' comments. I need to talk with Michelle because when we started this process, we did not say that we were going to make their comments public. However, I think because they're not directly attributable to an individual, we can put together a list of the external stakeholders who we contacted, and we could ask the internal stakeholders if they are willing to have their names be, but we were just going to summarize the overall discussion points. I'd like to be able to do that for the board, so I'll work with you on that. But what we'd like to do is be able to come back to the board and say, as part of our own deliberations, these are some of the qualities, et cetera, that our own staff and external relevant stakeholders feel should be part of our consideration. So we'll work with Michelle on that to make sure that we can provide some level of a discussion for that. And then after we have a pool of candidates, then we'll come back to the board and discuss next steps for how we want to begin evaluating those candidates with the intent of bringing in candidates for in-person interviews, and then kind of suggested format for those interviews. Some of this is nebulous because we still have to determine how much interest we're going to get in the position. As we are all very aware, public health is in a it's been a trying time in public health over the last few years, and so we are hopeful that we will get a wide selection of individuals that we can all, qualified and beyond qualified, that we can look at, but we're just kind of waiting to see what we have. And so that will drive the next, I believe that'll drive the next steps forward. A couple things I've handed out, or one thing I did hand out, Ann will provide to you, the board members, by email, the actual position description for the administrative officer. Also provided, this is also in your board manual meeting material, so this is not anything that does not exist anywhere. This is just a copy of the Board of Health agency roles and responsibilities broken down by Board of Health and administrator, which in this case is the administrative officer. So this is good for us to remember and have in the front of our mind as we go forward, beginning to evaluate applicants, so we know what our expectations of those candidates should be from the standpoint of doing the job for the administrative officer. So I did want to make that clear to everybody that this is kind of, in the past, the way we divided up the roles and responsibilities between the board and the administrative officer. That finishes my chair report. There was one other thing I was supposed to mention. And do you remember what I was supposed to mention? Was there anything else? I think I got everything. So at this time, I will ask for, are there any questions from the board of me? At this time, I'll ask for committee reports. So do we have a report from the executive committee? Nope. Budget and finance. Is that me too?
You're still the chair, sorry. Do I have to, at the next meeting, we can determine if I have to be chair.
Okay. Budget and Finance, at the last meeting of the Budget and Finance Committee, we reviewed the vouchers for February in discussion with our finance director, and found nothing unusual, and we, as the Finance Committee, Budget and Finance, voted to present those to the full board for their consideration, and we recommend approval of the vouchers for this month. Anything else? Mary? Anyone? Okay. And then anything from policy and education? I don't see any meetings scheduled, but nothing? Okay. So that concludes our committee reports. And so that brings us to item number 4 today, our consent agenda, consisting of the meeting minutes from the regular meeting for February 2023 and the February 2023 vouchers. Would any member of the board like to take any of those items individually? Not seeing or hearing anything. So at this time, do I have a motion on the consent agenda as presented?
So moved.
Is there a second?
Second.
Moved and seconded. Any discussion? Seeing or hearing none, all in favor?
Aye.
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 Any opposed? Hearing none opposed, the consent agenda is approved unanimously. Thank you very much. And so that brings us to item number 5, an executive session, which we do need. I will ask our legal counsel, Michelle Fossum, at this time to announce the purpose of the executive session and the members requested, or the personnel requested to be present.
Thank you. We will be in executive session for approximately 30 minutes for 2 different issues. First, evaluating performance of personnel under RCW 4230-110-1G, and then also litigation under RCW 4230-110-1I. Present will be the board members and legal counsel. And I should mention too, one of the first issues we're going to take has a potential conflict of interest for one of our board members, Alicia Pulikani, so we'll ask her to excuse herself for the moment.
So Dr. Polakani, we'll recall you when we've concluded that, that issue. Thank you very much. So at this time, we will be back in 30 minutes unless extended. text me and I turned my phone off. I'm sorry.
Oh, looks like Kelly's got it.
So the board has returned from their executive session. We originally, for the record, went into executive session for a period of 30 minutes beginning at 1:02 p.m. We had two extensions, one for 20 minutes, which extended us to 1:52 p.m., and one for 15 minutes, which extended us to 2:07 p.m. It is 2:07 p.m., and we are out of executive session. That brings us, no decisions were made during executive session, for the record. And that brings us to item number 6, our action items, beginning with Resolution 2301, authorizing the district to enter into an agreement with Dr. Sam Arts for short-term backup health officer services during the absences of our health officer. Carrie, would you like to take that, or just standard? So this is a typical, I'll just, for the board's clarification, this is a typical agreement that we have with a health officer, and we've had this agreement in the past with Dr. Arts. He provides backup services when Dr. Velasquez goes to vacation, et cetera, or is not able to perform his duties. He is compensated on an hourly basis for those services provided. He is the current health officer for the Tri-County Health District, and so meets all the qualifications of a health officer in the state of Washington. And so at this time, I would like the board to consider approving this agreement. Are there any questions for myself or Ms. Guerra, for Carrie, to on the contract? Seeing none, do I have a motion on the short-term agreement?
I move approval of Resolution 23-01, authorizing SRHD to enter an agreement with Sam Artis, MD.
I will second.
Moved and seconded. Any discussion? Seeing or hearing none, all in favor?
Aye.
Aye.
Are there any opposed? Hearing none opposed, the agreement, the resolution and the agreement is approved unanimously. Thank you very much. So that brings us to action item B, which is the SRHD Board of Health bylaws update to clarify board member performance expectations and authority of the Board of Health to appoint an administrative officer and health officer. I'm going to ask Michelle Fossum to begin leading the discussion on this. So Michelle, turn it over to you.
Thank you. So when the legislature changed the rules governing the makeup of health district boards, one of the provisions said that the county's resolution creating the board should identify the individual responsible for appointing the administrative officer and the health officer. So recently, the county made that revision to their resolution. It's 230185, and it provides that after a vote of this board, then the chair has the authority to enter into a contract with whomever the administrator will be in the future. In light of that, we needed to make some changes to our bylaws so that they would be consistent. So we've done that. Then we made some cleanup changes. We went from administrator to administrative officer, so I made sure that was the same throughout the document. And then at the request of a board member, the chair, we added language about attendance at the board meetings, which is consistent with a resolution passed by the SRHD board in 2012. And that's set forth in 3.6, which is that your expectation is to be at 8 of the 10 regularly scheduled board meetings and all special board meetings, and participate in board and committee assignments. I think that's a pretty good overview of the changes that were proposed. I would point out that our bylaws are normally a two-touch process, so we would review them today, and then they would come up again for final vote at the next board meeting. There is the authority to approve them today by a 2/3 majority, should the board be wanting to do that.
Thank you, Michelle. So first of all, are there any questions for Michelle on the amendments we've made to the bylaws, or the proposed amendments to the bylaws? So is the pleasure of the board to review these and conform to the two-touch and then consider them at the next meeting, or does the board wish to consider these for approval today? Any thoughts?
Commissioner Kearns and I will be gone at the next board meeting, so I'm happy to have us just move these forward today.
Is there anybody who wishes to have the two-touch? Not seeing any. So at this time, is there a motion
So-
on the updated?
Yes, I would move to approve the Spokane Regional Health District Board of Health bylaws update to clarify the board member performance expectations and authority of Spokane Regional Board of Health to appoint Spokane Regional Health District SRHD's administrative officer and health officer.
Is there a second?
I'll second the motion.
Moved and seconded. Any discussion? Seeing or hearing none, all in favor?
Aye.
Are there any opposed? I hear none opposed, and since there are none opposed, that was a 2/3 majority, so the amendments are approved per our rules, or bylaws, I guess. So thank you very much. So that concludes our action items for today. Thank you. And so we'll move on to item number 7, our reports. First up is our legislative report.
Thanks for having me, Board. For the record, my name is Brandon Bannister, Health Policy Specialist here at Spokane Regional Health District, and I will be giving you a update on the state legislative session and things that have been going on in regard to some of the priorities, legislative priorities that the Board of Health has put together in the previous winter. So just wanted to give you folks a overview of the timeline that the session is working on, some important policy cutoff dates, as well as, where we're at in the process and what kind of phase we're at in the session. So currently, most bills without fiscal implications are either considered dead or awaiting a vote by their opposite chamber of origin. With a few exceptions that have passed pretty quickly and made it to the governor's desk already. So right now the legislature is largely focused on the House and Senate biennial operating, capital, and transportation budgets. So it's eating up a lot of their time, both in committee and conference, and how that will be proceeded on the floor with all the various amendments that will be attached to those bills. Additionally, there's fiscal policy bills that are being debated and conferenced about in committee during this time, but that's kind of where we're at. It's mostly budget and fiscal legislation that they're dealing with right now. Some important cutoff dates. Yesterday was the last day to pass non-fiscal related bills out of committee from the opposite chamber of origin. And April 4th is the last day to pass fiscal bills out of committee, and April 12th is the last day to pass all bills out of the legislature that are not deemed necessary to implement the budget. And the legislature will sine die on April 23rd. So I imagine many of you will be pleased to know that there have been several bills that deal directly with priorities that have been set by the Board of Health in our legislative priorities. These are bills like 5022, 5365, and the rest that you see on screen. I'll just briefly go through those, what they do, and where they're at in the process. There's a complete list of public health related bills, should be in your binders and also available at the desk. They give a brief description of the bill's purpose, what they do, where they're at in the process. And yes, those are all public health related pieces of legislation, but for the ones that are closely related to the BOH policy priorities, we have SB 5022, which would exempt fentanyl testing equipment from the definition of drug paraphernalia. So this was a issue that the policy committee was discussing during our formulation of the policy priorities. Treatment services has had an issue with this categorization of drug testing paraphernalia for fentanyl specifically. So this one's on a good path. It passed the Senate unanimously, and it's currently scheduled for executive session in the House Committee on Community Safety, Justice, and Reentry as of yesterday, I believe. So I don't currently have an update on where that's at now, but given its current track record, it's probably moving forward. Next, we have SB 5365, which is seeking to prevent use of vapor and tobacco products by minors. This was obviously another big priority for the BOH, preventing vapor and tobacco use. And so this bill passed the Senate by a vote of 29-19. Received some amendments, and then got executive action taken on it in the House Committee on Regulated Substances and Gaming on the 23rd of March, and it hasn't moved since, but again, further updates of this bill should be able to figure out if it's going to pass since the policy cutoff date was yesterday. Next, we have HB 1004, which would seek to install signs on or near bridges to provide information to deter jumping. This was something that was suggested to us by the Suicide Spokane Coalition that made it into our Board of Health policy priorities as just general ideas about how we can lower suicide rates and increase suicide prevention. So great bill that kind of aligns with the goals of the BOH policy priorities. It passed out of the House by a unanimous vote, and now it's in the Senate Transportation Committee. Next, we have HB 1006, expanding access to drug testing equipment. Another piece of legislation that's probably of concern for divisions like our treatment services. Passed out of the House by a unanimous vote, or I'm sorry, excuse me. This one did actually pass out of the House by unanimous vote on the 8th, but it's still awaiting a public hearing in the Senate Law and Justice Committee. Next, we have SB 5367, which would redefine THC products to include synthetic THC and derivatives of THC, such as Delta-9, to be included in that definition of THC. So this was something that was directly in the BAOH legislative priorities because we've seen an uptick in youth purchasing CBD products, synthetic THC products that have given those youth the ability to get high off of. So they are currently being sold in non-502 stores. So this legislation would redefine THC to make sure that those stores would have a license before they could sell products that have synthetic THC or derivatives of THC. And that bill passed out of the Senate by a unanimous vote. And passed the House Committee on Regulated Substances, Gaming with amendments. But it's now awaiting a hearing in the House Committee on Appropriations. Next, we have HB 1255, which would reduce stigma and incentivize healthcare professionals to participate in a substance use disorder monitoring and treatment program. This was almost verbatim something that was in our legislative priorities for 2023. This bill would direct the Healthcare Authority to create a post-delivery and transitional care program for people with substance use disorder at the time of delivery. I'm sorry. I'm looking at the wrong bill. My apologies. This would basically create a fund for healthcare professionals to cover the costs associated with them participating in substance use disorder and monitoring treatment programs. So it would give them a little bit more guidance and a little bit more education on the issue should they choose to do so. Next bill that I was just talking about is SB 5580, which would improve maternal health outcomes. It directs the Healthcare Authority to create a post-delivery and transitional care program for people with substance use disorder at the time of delivery, allowing for extended post-delivery hospital care, starting in January 1st of 2025. It also requires the HCA to update the current maternity support services program by 2025 to address perinatal outcomes and increase equity and healthier birth outcomes. This passed out of the Senate by unanimous vote on the 8th of March, and as of the 28th of March, it was scheduled for executive session in the House Committee on Healthcare and Wellness. So these are just some of the bills that are directly related to the policy priorities that the BOH has set. And so, as I said previously, there's a complete list of public health related legislation in that bill tracker that's in your binders. So feel free to take a look at all of those and see where everything's headed. Happy to answer any questions after this presentation about any of those pieces of legislation.
Any questions? Thank you very much for the comprehensive report. Appreciate it.
Yeah, not quite finished yet.
Oh, sorry.
Yeah, no problem. So just a couple quick highlights about the biennium budgets. For the operating budgets proposed by the House and the Senate, there's an accumulative $324 million being proposed for foundational public health services. So this is an increase of $100 million in comparison to the last biennium. So that has kind of been spearheaded by our trade associations, Washington State Public Health Association and the Washington State Association for Local Public Health Officials. They've been working really hard on getting those asks in the budget, and so they seem to have been successful. Obviously, those budgets haven't been passed yet, so can't count it as a total win yet, but it's definitely got some good groundwork. And there's also some additional budget provisions being negotiated by Senator June Robinson around smoking cessation funding. And so those are some of the highlights for the operating budget as they relate to the work we do here. And then a brief little update on why I wasn't able to present this information to you folks at the last board meeting. I was taking part in the WISFA and WISALFO 2023 Legislator Education Day. It was awesome. We had over 100 public health advocates and workers in attendance. Just going down to the legislature to meet with representatives and senators to educate them about public health issues. As a member of Spokane, I was able to partner up with Jeff Ketchel, the executive director of WISFA, and got to meet with legislative offices from our district, such as Representative Riccelli's office, Representative Ormsby, and Senator Billig. During some of these conversations, we addressed the public health implications resulting from FPHS funding, from smoking cessation funding, and the implications of a lack of regulation around synthetic THC sales. That's about everything I have for you folks today. So if you have any questions, happy to answer them. If anything comes to mind afterwards, feel free to email me.
Sorry, now questions.
Yes.
Any questions? Actually, Brandon, I have a question back on the discussion for FPHS.
Yeah, absolutely.
Is there any information out there on how those funds are going to be allotted or distributed as they are?
Yeah, that's a good question. So from my talks with WISFA and WISALFO, as well as my readings of the budget, it seems like they are going to be, those funds will be a lot more, what's the word I'm looking for, appropriated than in previous years. And so the legislature is kind of taking a little bit more of a micromanagement approach into how some of those funds are being used than they have previously. I don't know exactly which pots of money are going where right now, but I can definitely figure some of that information out for you.
It would be at least at a level. It would be nice to understand if it's going to remain with DOH or if it's going to be allotted. How much is going to be allotted to the LHJs?
Yeah.
Because we seem to talk a lot about FPHS and how much money we're giving as the state. And that never seems to really get down to the LHJs in any meaningful way for us to do anything. And so it would be nice to understand that.
That's understandable. I can definitely try to figure out, what kind of distinction there is between amount of funds being allocated to DOH for administration versus the LHJs. Would that satisfy?
Yeah, that would be good. I don't think we need it broken down by program,
Sure.
but it's because in the past, I'm sure you're aware that it was pretty formulaic as to for FPHS.
Yeah.
If it wasn't program, if it was a unencumbered, undirected allotment for just LHJ, FPHS, it would be interesting to know if that is going to receive any more money, and if it is, if those formulas are going to change.
Yeah, from my understanding, at least from the conversations and the recaps that I've gotten from folks that have dug into it a little bit more, it seems like they are actually trying to direct less of those funds to the discretion of the DOH and more directly to some of the activities done by LHJs. But I can get, more specifics on that if you'd like. Sure.
Thank you very much.
No problem.
Any other questions? Thank you.
Thank you so much.
So, financial report, Ms. Kremers.
Good afternoon. This will be fairly brief this month. February's pretty routine. You all should have a copy of the financial report for February in your packet. As I've mentioned before, our federal and state grants are reimbursable. So that means we expense the funds in the current month and then request reimbursement the following month. So we're lagging there in the federal and state grants. So you'll see they're very small at this point. Those will be coming in the month of March. Our Medicaid, Medicare is right on target, and those are billed throughout the month. And same with the fees and permits, those come in as well. So those are reflected there. And so we're still, we're only at $902,000 for revenue. But if you'll recall, January's revenue was more significant because we had some of those funds that do actually pay in advance, like the FPHS, and we had some county contribution quarterly. So those were reflected in January. For 2 months, for February, we'd expect to be about 17% of the overall budget, and we're running at 14.7 for revenues and 14.5. So just a little bit of a positive fund balance through February. The expenses, just under 4 million, are pretty standard. So I wanted to point that out, that our unassigned reserves were at about 12 million too. And the state auditors like to look at what sustainability of it at a local health jurisdiction or any other agency they're reviewing. And so 2 to 3 months of operating expenses is what they look for as a healthy reserve. And since we're sitting right at 12 million, that's looking good for the health district. And also, we're above our 20% goal of reserves. So currently in the finance department, we're wrapping up 2022. I mentioned before, our books stay open for 90 days to make sure we can accrue anything that should go back to the prior year. So we're starting to prepare our annual report, and we'll be sharing our financial data with Spokane County by April 30th so they can incorporate the health district numbers into their financial report this year. With the structure of the Board of Health changing, previously the commissioners held 50% of the board seats, and now it's 75%, and so that's considered a component unit to the Spokane County for reporting. So there'll be some financial numbers being incorporated from the district into the county's financials, which is new this year. Been working with Jason and Jenny. And then we'll still continue to do our own annual report and filing as well with the state auditor's office. And the deadline for state auditor annual report filing is May 30th, and we're working towards that. And then shortly thereafter, we'll get into the audit period with state auditors in June. And I'm still working on 2022, so next month I do anticipate bringing a report forward. Yes?
So on the board members, because since it was new, the commissioners were the ones that and Mayor Freeman, because we knew Mayor Freeman was going to be a board member. So it was
It looks at the 3 commissioners on the Board of Health of the current structure, plus the 3 appointed, would be the 6 out of the 8.
But I believe the 3 appointed are actually by the Board of Health. We just didn't have the board established because of it being the first year.
Mm-hmm.
So in the future, it would be this body that appoints any of those extra positions.
Okay. Oh, so
It
this
is-
may be that's something I'll review then with
Yes,
Spokane
so
County.
this,
I don't necessarily know that's true, because you gotta read that bill, because it sounded like they had to be approved by the county commissioners, not by the board.
oh, I think you're right. The final,
The final approval of the appointed members is done by the county commissioners.
the board, okay. yeah.
As recommended by the Board of Health.
Yes.
That's right.
So I think that's where
Okay.
Yeah, because it's,
the control of the
Okay,
6 out of 8.
there we go.
because,
Thank you.
yeah, because that's what's weird. They're your appointments at that level, so. Any other questions for Kim?
I'll have more to share next month. For
Great, thank you very much, appreciate the report.
Thank you.
Thank you. Now our administrative officer report from Lola Phillips. Ms. Phillips.
Hey, good afternoon. We will start with staff kudos. So if you're aware of the process here, we have a regular staff updates and a staff forum, and we ask our team members to share kudos from other team members or about other team members, and we like to share them with the board occasionally. So, and then after the staff kudos, Kelly Hawkins is going to present on National Public Health Week, and then we'll talk about the local Board of Health training coming up in May. So first is Kyle Richardson. He transitioned into the Public Health Emergency Preparedness Program in September of 2022 to the role of Medical Reserve Corps and Resource Coordinator. Kyle manages the scheduling of volunteers as well as developing and keeping the various systems and processes in place for tracking and communicating with both volunteers and the internal and external partner requesting the MRC. We appreciate Kyle's positive attitude and work ethic. Kyle is a very valuable member of the Public Health Emergency Preparedness team at SRHD. And then Tammy Myers. Disease Prevention and Response and SRHD acknowledge the extraordinary work of our new homeless outreach coordinator, Tammy Myers. Tammy has been instrumental in assisting our team with locating and completing treatment for individuals who we would not have otherwise been able to engage in services. We are very fortunate to have Tammy at SRHD with her knowledge of community resources and client connections. And then from our Public Information Office, Amy Jennings and Jackie Post. Kudos to Jackie Post and Amy Jennings for their completion of our website's homepage updates, which went live on the first of the year. Their goal was to make visiting our website more user-friendly, to make it easier to find information or community needs, and to showcase more of the work being done by our programs in the homepage. Thank you, Jackie and Amy, for always making us look good. And then finally, for kudos, we just want to recognize the HIPAA and Records Office accomplishments for 2022. SRHD commends the HIPAA and Public Records Office team in its 2022 achievements. A big congratulations to Julie Beth Montiel for achieving her Washington State certification as a Public Records Officer. And through their hard work, the records team completed 449 public records requests and created several new trainings for SRHD employees in 22. This includes record retention training, public record request training, HIPAA and security for our onboarding employees, and HIPAA and security training review for new employees, or current employees, So well done, everybody. All right. And next up, Kelly's going to talk about National Public Health Week. There you go.
Hello, everyone. So we're really excited because next week is National Public Health Week, and the overall theme that's on the national level is centering and celebrating cultures in health. So we're really looking at how we've learned from our communities that we're born into and that we build together, and we're talking about how we all work together to make Spokane County the healthiest community it can be. Different things that we talk about are how we're engaged with our community to make it a healthier place to live. What have the different cultures, different ethnicities, the lifestyles that make our community diverse, what have those done to help us improve public health? And we're celebrating our community successes. So public health isn't just the work of SRHD. It takes the work, collaboration, and inspiration of our entire community. So we're looking at our community leaders as our health leaders as well. And we're celebrating the unique and joyful ways that different cultures focus on health. And look at, again, how we can learn from each other. So we're celebrating the different public health successes that various community groups and populations have achieved while working with the Spokane Regional Health District. So if you take a look at our arts community, for example, their ingenuity in creating a safe workplace for musicians performing with the Spokane Symphony during the COVID pandemic was a great success within our community, and within that community specifically, the arts community itself. The LGBTQ community and their successful collaboration between many individuals, many businesses, the Spokane AIDS Network, and SRHD during the Mpox outbreak to educate people about the virus and to vaccinate those most at risk. And another example of a success is the Latinx community and Latinos in Spokane for their effort to provide accessible, healthy, culturally appropriate food options at the Mercadito Market. So those are just some examples that we get to highlight over the next week of how we have worked with different cultures in having success in public health. So we'll definitely be sharing our message through a mix of traditional communication channels and through digital media. Our primary tactic will be to reach broad audience through our digital channels. So we have some paid messaging going through a digital campaign. But then we also will be utilizing web and print and radio to target opinion and community leaders who are likely to advocate for public health initiatives. And of course, just reaching out to our partners and encouraging shared messaging Our city and county proclamations, thank you to those of you who are part of that, are part of work. Well, okay, we need to get to, yes. I'm getting an eyebrow lift from Mayor Freeman. I will. But we'll also have lots of video storytelling. It's not too late. We're also working with our city to light up downtown. So with the blue lights, working with the Downtown Spokane Partnership to light us up and to get our logos on all of our buildings. So you'll see our little man on the clock tower again this year as well. And then our banners, we'll be sharing our messages at River Park Square, at the Spokane Valley Mall, and then of course our giant banner that will be here on the building. And then we are going to have a public health panel with SRHD leaders. So we'll keep that conversation focused on those programs that are actively involved in the community and whose work isn't necessarily recognized, but that we know makes a direct impact on the well-being of our community. So the division directors representing us are Ray Burns, Director of Environmental Public Health, Misty Challenor, Director of Treatment Services, Melissa McDaniel, Director of Community Health, and Dr. Frank Velasquez, our Health Officer, and also Director of Disease Prevention and Response. And so everyone is welcome to attend, providing we have room in this room. But we'll be recording the event so that everyone can watch regardless of where they are or where they're working that day and how their schedule permits. And then don't worry, we're not forgetting about the amazing staff that work here and that this week is celebrating. So these are some photos from last year. We have some fun planned for them too, with an open house hosted by our 4th floor, which is Environmental Public Health and Disease Prevention and Response. It's a great way for everyone to get out of their comfort zones and learn about each other and the different programs. And as part of our team, you guys are invited to come. That is going to be on Tuesday between 11 a.m. and 1 p.m. So I guarantee you'll learn something about our programs that you probably didn't know about, and you'll have some fun. And the 4th floor is really great about bringing food to everything, so they'll feed ya. That's everything from me. Any questions?
Questions?
Say,
Go ahead, Amber, sorry.
I'm sorry, I have to step out for another meeting, but I just wanted to say thanks for all your hard work to promote public health all over the community. That's really exciting. Will you be having different social media posts that we can share out
Definitely.
as board members?
Please share our
If you could
posts.
send us just even some little contents or things that you've shared, then we could reshare out and encourage people to attend those meetings. That would be great.
We will do that.
Was, for the April 6th presentation, was there any desire to have anybody from the board there?
You should have all received an invite for that.
Was it to be on the panel?
No. Oh, no. Yes, when you get here, we're just gonna pull you right up on. No, the health leaders that I introduced are gonna be on the panel, but you were all invited to come and sit and participate. Yeah. Participate
Right, let's
as
see.
an audience member.
Yeah.
There we go. All right, thanks.
Thank you. So, continue,
Yeah, I was
sorry,
gonna
Laura.
say, So just really quickly, and as a reminder, that Wasalfo and Wasac are sponsoring the Public Health Law and Governance Training for local boards of health. This will be May 2nd through the 4th, 2023. The agenda includes learning more about public health issues, how to drive work as a local Board of Health member, how to work through complex public health issues, public health emergency law, and crisis and risk communication. And Ann Pittsnoggle will be sending information to all of the Board of Health members after this meeting today. So that is all. Any questions?
Questions from Ms. Phillips? Thank you very much. And now our report from our health officer, Dr. Velasquez.
I don't like using the mouse, I use the keyboard. Good afternoon, everyone. Thank you for being here. So before we start, I just want to say today is National Doctors Day, so I want to say thank you to all of our providers, our colleague, Dr. Policani, and all physicians and providers that we have in the community. We acknowledge them at our Facebook Live on Wednesday. That's why we have the red carnations, which is the symbol of National Doctors Day today. And those were a gift from Kelly and the team upstairs when we did the Facebook Live. So I have about an hour of slides, but I can do them about 7 minutes. A lot of it is for your information, just so you have it for your for later. Okay, so these are the three topics I'm going to talk about. The first one we've talked about before. Second one, I'm going to say a few words about fentanyl and e-cigarette and vaping, which are becoming issues that we need to be concerned about. And the last one, I'm only going to show one subject, but I wanted to share this with you. That is the agenda from our spring meeting with K through 12 superintendents, headmasters, head of school, et cetera, for the whole region. And we actually had a very busy agenda with a lot of topics. There were about 8 members of the team that did presentations to all of these folks. And we have a full meeting coming up with the same format. We've already received a lot of positive comment from the superintendents and follow-up questions in terms of, can you share this with me? Can I get more information? So I think we met the intent of the meeting, which was to provide them a fairly broad health and public health update as opposed to just focusing on communicable disease. So I wanted to call that out because a lot of work that the team did, and they did an awesome job. We have all of the materials. If anybody's interested, I'm happy to share those. They have been distributed to all of the participants already. So I want to talk about just one thing in that area that is a new program that we just started, but I did want to highlight the work of the team members because they did a really, really good job, as they always do. So let's talk a little bit about this. COVID is not gone. As we know, we're basically talking about variants by now, and the question is which one, but I think right now, any of the Omicron sublineages and variants continue to be mild. XBB 1.5 has been dominating across the nation. And if you look at the 10 health regions from HHS, you will see about the same distribution of colors. So we're very standard, although Washington State is a little bit slightly different if you look on the right-hand side, and that is not uncommon. We have seen that difference between the national level for the last probably 6 months or so. It doesn't really mean very much. It only means the distribution has not been equivalent, which we saw with most of the Omicron sublineages. The point behind all of this is still here, still around, so we still have to be mindful. And I'm going to show you, if we look at where we are, these are the key take-home messages. Number one, high baseline both on Eastern Washington, Western Washington, which basically means hasn't gone down to zero. Not projected to go down to zero, at least in the next several months. So we're still going to have some disease in the area. We continue to be mindful and we continue to make recommendations in terms of know your risk and make sure you're protecting yourself and those around you. We have seen a decline in Eastern Western Washington in disease, particularly in the senior population, which at one point in time really went sky high if you look at these curves, which is a good thing to know because that was severely impacting next graph, which is hospitalization. This is Eastern Washington, this is Western Washington, slightly higher number in Eastern Washington in terms of COVID-related hospitalizations per 100,000 as compared to Western Washington, but both somewhat stable, still having somewhat of an impact, although not as significant an impact as we saw with a combination of the flu, RSV, and COVID in the last few months. So more to come on that, and I do know our healthcare systems are catching up with procedures, although they're still a little bit behind because of staffing and other things. So moving forward, this is the projection from IHME, which you can see there's no going down to the baseline. We're still going to see perhaps a few peaks and valleys coming over the next few months, and as we all have heard, the masking requirements are going to change on April the 3rd. as the order from the Secretary of Health is rescinded, causing a lot of confusion. I can tell you locally, we've been in conversations with our healthcare partners trying to be consistent among the community. It's hard to get consensus because our large healthcare systems are part of larger systems, so there's a lot of that we're talking about. But the reminder that even if that goes away, there's still LNI as well as other infection prevention and control guidance that needs to be met. I think overall, most organizations are going to probably go back a little bit to what their respiratory illness protocols have been and just be a little bit more assertive about following those, with perhaps some specific requirements and or strong recommendations based on risk areas like in oncology, for example, which if you think about it is not uncommon. We've done that forever with flu and other things. So more to come on that, and as soon as we see the release from the Department of Health, et cetera, with specific language, we'll share that. Now, switching gears a little bit, since COVID is going to be around, one of the things we're going to do is look at not relying as much on the testing that it gets done in the community, whether it's antigen testing at home or PCR testing, and actually look at using wastewater. As you know, we've been doing wastewater testing for quite some time, and it's actually both on our website and the CDC website. And the reason why this is being done is because you can detect the presence of the virus, which is relative to the presence of the virus in the community. It's not a one-to-one relationship, but it's very good. But we've been doing it in the large 2 substations. So our goal is to have we're actually pursuing a joint project with WSU, Department of Health, and others to do neighborhood-based surveillance, meaning going actually into the manholes and or the pumping stations with the help of our colleagues from the county and the city to actually do that for 3 months so we can determine if that is if there's significant advantages doing that in terms of potential disease prevention. Based on the literature from around the world, it seems to be an advantage, so we're very excited about that. More than likely, we'll start whenever spring decides to actually be around, like for sure, sometime in April-ish or so, we're going to start doing that. And these are all the participants of that. So I do appreciate our partners, not only at WSU, but also our partners in the county and the city that are helping with that. So with that, let's talk a little bit about fentanyl. A lot of people here know a lot about fentanyl, but I just wanted to highlight a few things. First of all, as we all know, is a pharmaceutical has been around for a long time. It's highly effective in chronic pain, particularly that of things like cancer. It is a synthetic opioid, and that is critical because that's what has made it so easy to manufacture in other scenarios. So we do know that it's about 100 times more potent than morphine, and that has to do with a number of issues. One of them is the fact that it goes through the blood-brain barrier a lot faster. So it's not hours, it's actually minutes at best, which is also what makes it more lethal if used inappropriately. Now, we do know that people can overdose in a matter of minutes as opposed to half an hour, which is what we see with things like heroin. And the reason for that is that rapid crossing of the blood-brain barrier and the fact that it's at 100 times more potent than most of the things that we have. So if you take a pencil, that is enough to kill you, which is about a gram or two. Give you some context, about a milligram. About a milligram is the weight of a raisin or the weight of a paperclip. That's actually the weight of that. And I thought that was very telling. Now, the issue is we've seen overdoses go up over the last several years everywhere, including Spokane County. I'll share those numbers with you. And the reason for that is because it's highly accessible, it's made its presence known all over the country, and there is enough fentanyl out there to pretty much kill every citizen of the U.S. a couple times over, which is a scary thought, but it is the reality. In addition to that, it's not the typical scenario where you have someone that abuses substances that may end up in an overdose. This is actually accidental overdose by one-time users that purchase what they thought was a particular medication online, and it's not, because of counterfeit pills. So this is what we've seen, and that arrow that went up is 14 to 18. 14 to 18 years of age is actually the highest risk group right now. So it's one of the reasons why we're working a lot with our schools, because part of it is if you talk to children, and at that age they're still children, the perception of danger and or risk is less than 20% of the population. 80% of them, 70, 80% of them think that it's not going to happen to me. Not a big deal. I'm going to be okay. And if you talk to the families, it's about 30%. So we need to do much better at education. This is what we have in Spokane County, and the numbers may not be as big, but 186% increase for a community our size is a lot of people. And that's one of the reasons why we're not only actively promoting education and going to various places to talk about it, but we may have some other ideas about how else can we be more active in this particular process. This is on the right, Spokane County, on the left, Washington State, and unfortunately, we mirror the trend exactly. So one of the concerns is counterfeit pills. You can see that you see the authentic ones and the fake ones. They're very similar. Those that produce this type of counterfeit pill have purchased the seals or fake seals, so you don't know which one you're taking. So you may buy what you think is alderol or oxycodone for either one-time use or for sharing, and you may actually end up dead, because we do know that a significant number of these pills have lethal doses of fentanyl. The reason why I put the colored ones around Halloween, we saw an increase in the number of colored pills that look like Skittles, and concern is, are those making it into the younger population just because of resemble something that we all know about that is very colorful. Now, we do know in the U.S. about 6 out of every 10 pills has a lethal dose of fentanyl. It's 1 or 2 milligrams and varies by weight of the person. Now, to make things even more complicated, over the last few months, we've noticed an increase in the number of pills as well as powder being confiscated that has a high concentration of xylazine. Xylazine is a veterinary tranquilizer used in horses. It does not bind to receptors in the brain. It's not an opioid. So when you mix it with fentanyl, and we're seeing that a lot, it can be extremely lethal because you cannot reverse the overdose with Narcan. Narcan does not work on xylazine. Now, there's no testing available at this point, although we're already working with community partners to see how we can have testing in the community. It all started a while ago. East Coast, particularly Philadelphia, moved over, started in Puget Sound area in Washington, and now it's here, and I hear anecdotally we have it in Spokane too. Now, we cannot confirm that because we don't test, but to make it even more complicated, this is even more lethal than fentanyl on its own. Yes, sir.
I have a quick question in my mind. Is xylazine also a synthetic opioid, or is it just a binder or something that's being mixed?
Yeah, it's actually an add-on, it's a tranquilizer. So it's not a synthetic opioid. It's a veterinary tranquilizer used for horses, basically. Yeah. And the issue is that it has such a synergistic effect on the high and the euphoria that you get that unfortunately makes it, this combination makes it highly addictive. The problem is that it can also be extremely lethal. And even with Narcan, you can't reverse it just because of the combination of those two acting in various, in all of your physiologic systems. And unfortunately, at this point in time, we don't have well-distributed testing mechanisms to figure out that is there. Basically, all the data that we have is from either some of the centers that are doing research, EA, and others. So it is a concern, and we're starting to educate. By now, there's a percentage, depending on where you read, that can be as high as 20% of all the counterfeit pills have xylazine by now. It enhances that desire to get more, if you survive, of course. So one more thing that we need to think about, and unfortunately something that we need to worry about. So let's talk about vaping, and vaping is technically is a misnomer because when you vape, it's actually not vapor, it's an aerosol, but we're not going to get into the definition of one versus the other. But basically what we have, and you look to the left, right, and bottom, those are different types of devices that are used, and they all have the same construction, basically. There is a mouthpiece, which is where you inhale. There is a cylinder of some sort that contains the chemicals that you're going to heat with a battery. And that can be used for a lot of things, and although we do know that regular tobacco use has gone down, in the country we still know that thousands of kids under the age of 18 still either smoke or chew tobacco as their entry into other things, and vaping is making it easier for that nicotine addiction to occur, because 99% of all of these devices, even if they don't say they have it, they have nicotine that is either disclosed or not disclosed. Now, in addition to that, as you can tell there's a lot of other stuff that comes in that aerosol that you inhale. Not to mention the potential for this thing to blow up in your face, which has happened. There's been at least one death reported and caused significant burns because of overheating by the battery. We actually did a Facebook Live last week on this with our team from Tobacco, Marijuana, and Vaping Device Prevention Services. Long name, but it used to be one issue, now we have three. Now, biggest issue for younger people is nicotine. We do know that the brain continues to develop up to the age of 25, give or take. Although those that have kids that are 30 will question that number. But I'm not a neuroscientist, so I will not question the number. But one of the issues that we know is as you grow older, beyond your first 5 years of life or so, you start to accumulate knowledge and experience. And a lot of that is based on synaptic connections. And one of the things that we do know is that nicotine has an impact on those synaptic connections. That's science that has been around for a long time. And one of the concerns is that causing some of the cognitive behavioral issues that we're seeing on some of these children that are vaping and using nicotine. The long-term effects of vaping are not known at this point in time because it hasn't been around long enough for us to know it. We do know that is since 2014 has been the most commonly used vehicle for the use of tobacco and, of course, nicotine. At this point in time, 1 in 7 high school students has vaped or is vaping in the U.S. That's a lot of people. Here we have the percentage of Spokane County youth in 6th, 8th, and 10th and 12th grades, and you see the graphs, and you probably see the ups and downs. The up on 2018 is mainly related to the new entries into the market, particularly of flavor products that became 40% of the market. Those products were removed from the market last year in June. And in 2021, we saw a decrease mainly because of virtual learning. Most kids were at home, so either the peer pressure and or the access was decreased. We don't have the numbers for 2022 yet, but those will come and we'll see what those look like. The issue here is that the number across the country, we're about 30%. Across the country is in the 20s. So locally, we had a much higher percentage of vaping than the national average, which is not where we want to be. So we all can talk to our kids, whether they're 30 or 6, and make sure that they have that information. So with education, I have one update that we're very proud of. I want to talk to you about stock epinephrine, the equivalent of EpiPens, although EpiPen is a brand. And the reason for this is in our conversations with our partners from K through 12, we became aware of the fact that there are issues occasionally with children that need an EpiPen because they forgot, they throw at their sister, it broke, it expired, and that poses a risk. We do know that 1 in 13 children have food allergies at this point in time. That's 2 kids per classroom in Spokane. And that's about 40% of those have high risk for anaphylactic shock. 20% of those cases of anaphylactic shock that we see happen in schools. Why? Because kids spend a lot of time in schools. So we work with our schools, and thank you to our general legal counsel who helped us put this together. So now we have a program where we have a standing order and a prescription under the health officer's order and prescription for schools to stock EpiPens under our supervision to administer as needed. School nurses are typically trained. There's a training and certification program that the OSPI and the schools have to do that. All we're doing is providing the prescription and the standing order for them to be able to stock that and replace it. Those will expire. They're only are available for the calendar year, and they expired every year, so they have to be renewed, which will give us the opportunity to see the utilization. So that's all I had for you. I'm going to stop here and see if any questions.
Sorry, it's just scary what's going on out there for our youth.
Yeah, it seems we're finding more creative ways of harming ourselves occasionally, which is unfortunate. And I think if you think about it, there are many components. Things, like my grandma used to say, nothing happens in isolation. There's always multiple things. And we could be talking about mental health, behavioral health, a whole bunch of issues that are either synergistic or intertwined. And unfortunately, many things end up in potential danger for a young person, which is the unfortunate thing. But we're seeing a lot more ways of getting there nowadays. So I'm going to stop here and see if there are any other questions. If not, thank you. And again, happy Doctor's Day to anyone that is listening out there. Thank you.
Well, our chair stepped out for a moment, so I guess I will step in. The last thing on our agenda before adjournment is board member check-in. So, Commissioner CUNY? Mr. Patterson? Yeah. Board member check-in? Mayor Freeman?
I'm all talked up.
Yeah, me too. Okay. All right, well then that brings us to adjournment. So, we'll see you next time.